Hello, everyone, and welcome back to Breast Practices here on Facebook Live, where each week we have the chance to speak with our special guest experts about best practices for guiding the breast cancer treatment journey. This is an especially important time for this discussion, as breast cancer patients and their care teams are learning on the go how to navigate the COVID-19 pandemic. On previous shows, we talked with a breast surgeon, a nurse, a patient, and patient advocates about how COVID-19 is impacting them and how they're coping. Today, we're continuing to dig deeper to gain a better understanding of the breast cancer treatment journey during this difficult time. In that journey, often getting back to normal can be the hardest part, is what I tend to hear from patients. And today's guest is a very special one. Her name is Tara Williamson of Pink Ink Tattoo, and she uncovered an important part of the healing journey that was missing for most after breast reconstruction, a realistic reconstruction with nipple and areola. And I only recently learned about it myself, and so I'm looking forward to learning more from Tara today. And I think that it's such an important part of that emotional healing journey. She decided to do something about it by combining her medical skills, talents, and unique insights. But all of that is now impacted by COVID-19, causing postponement of procedures and the mental and the emotional impact that's having on her patients. I'm Fazla Seeker, President and CEO of Molly Surgical. And I'd like to tell you a little bit more about Tara. She's a fantastic lady, and she is a 7-year breast cancer survivor herself. She's a nurse and an internationally recognized areola tattoo artist. At the age of 39, Tara was diagnosed with invasive ductal carcinoma. After struggling to get the realistic reconstruction she and others deserved, Tara set out to learn from the best artists in the country, and in 2014, she started Pink Ink Tattoo, combining her nursing background and tattoo artistry skills. If you have a chance to check out her website, I encourage you to do so. She does some fantastic work. And on top of all that, as if it wasn't enough, Tara is also a kidney donor for her sister. And we're just so honored to have you here today, Tara, on Breast Practices. Thank you so much for joining us.
Well, thank you for having me. Thank you so much.
So just before we get started, I just want to remind our viewers, we are live, and don't forget to comment below with any of your thoughts, but especially your questions. And Tara and I would love to be able to have a chance at answering them and helping you through your breast cancer treatment journey or that of your loved one. And what I'd like to do is start out with our first question. So Tara, I think it's just so fantastic, as a nurse and as a breast cancer survivor, a kidney donor, you've been through so much and you're giving so much. What does the COVID-19 crisis look like for you, and how are you coping? Are you having to isolate yourself?
Well, it's definitely, COVID-19 has impacted, my business Pink Ink Tattoo dramatically. As soon as I recognized that this was something extremely serious and a lot of people were going to be affected, I immediately just made the decision to go ahead and stop seeing clients. And although it was so heartbreaking for me because I love what I do and I'm passionate and I know the impact that it has on survivors, but at the same time, their safety as well as mine is number one. So I made that decision to go ahead and stop. And, of course, I let everyone know we've rescheduled out for, I have some going lightly into May, but as far as, when we knew this was serious, I knew, it needed to stop. So basically, my company, Pink Ink Tattoo, just came to a halt, and, we're just on standby waiting to see how this is going to continue. Hopefully we can transition and start doing, getting back to work safely and slowly. So, but it's hard because it does impact, when you have reconstruction, being diagnosed with breast cancer is so life-changing. I know, I went through it in 2012. And when it was time for the areola tattooing, I thought, oh my gosh. And I was so excited because being a nurse myself, I had taken care of breast cancer patients, and no one had the tattooing. I didn't even know of it. And I have a few tattoos, but I had never heard of areola tattooing. So I was really excited. And for myself, I felt like this is it. This will be the completion. I'll be done. I'll feel whole again. I'll feel like myself, as best I can, and just move forward. And that, that wasn't the case. in my story with my tattooing, it was just, not a pleasant experience and unrealistic. So when I started this is what I want to give to women, like this, make this experience, so beautiful for them and a happy ending to this nightmare. So for me, I understand when they're ready, they're ready. And so when I get a phone call, most people don't want to wait 6 months to come and see me when they're done having either nipple reconstruction or just the, reconstruction. They call and they're like, how soon can you get me in? And of course, I try to accommodate them as soon as possible. And so now it's like they know and I know we have to wait.
Right. And so I can only imagine, just the mental and emotional anguish that creates, because getting back to normal is something I tend to hear is a very difficult part of the breast cancer treatment journey, just recovering. And it's almost, I'd love to hear your experience. Is that what you found too, that getting back to a feeling of normal was the toughest part of the experience? Or what do you consider to be the toughest part of your own journey?
When I was diagnosed at 39, I had no family history. And so I had nothing to go off of it except for just knowing patients and hearing their story or reading in their chart. So for me, having somebody close, like a family member, I didn't have that. I had a girlfriend that had gone, was diagnosed a year prior to me, but she didn't have reconstruction. So I didn't have anyone to bounce anything or ask questions. So I doctor Googled everything. And, I was so scared of the unknown, but I did know that if I was a candidate for reconstruction, that's absolutely what I wanted to do. And I wanted to do everything I could to get feeling, with realistic expectations of reconstruction, because it's not a breast job. I didn't have an augmentation. I knew they were removing my natural breast and going to create something. And so going into that mindset of knowing like, this is realistically, it's not going to look like it did before, but if I can get something close to it, I'll be happy with that. And so I think helped me in that reconstruction process. So I wasn't disappointed, and I was actually happier and more surprised with the outcome, because I just set it to be, if I can have something to make myself feel and look. So when that shower curtain comes back,
Yeah.
I feel more like myself.
Yeah.
So it was pretty important for me.
And so you can especially relate to your patients who are having to be on hold right now, and they can't, have that same feeling of, getting back to normal, and that same experience that you had. And waiting can often be the most difficult part of anything. So how has that been for you mentally and financially, for your business, having to postpone your patients, and how are you coping yourself, and how are you helping your patients cope?
Well, with my clients, I understand, and they do too, and it is hard, and we've talked about it, and we've had, I mean, sometimes when survivors call, it's not just about like, how does it work, Tara, and when can I get scheduled? Like, we have a conversation, because this is a community, like a sisterhood. They know I've been through it, so we just start going talking about like this treatment, or oh my gosh, did you experience this? So when we're talking about this COVID-19 and the impact of waiting, it might be 6 months, it might be 4 months, what you're comfortable with and what I'm comfortable with. And and I work out of plastic surgeons' offices. So my home office is a plastic surgeon.
Mhm.
And, if they're closed, I'm definitely closed. So that I take in factor as well. But with, women that are seeking my service, we talk about it, and they, for the most part, everybody understands. I've maybe only had a couple women who are just a little frustrated and didn't really take this COVID-19 seriously, and then when I talk to them and I'm like, you went through chemotherapy, like you have a compromised immune system,
Yeah.
and better safe than have to worry about, being, in an environment
Yeah.
that could.
The last thing you want is to take that risk, come in, and now you're coming out with a much bigger problem, and that you could have
Right.
fully avoided in the first place. I mean, it's all about, what's removing the risk, and not taking any unnecessary risks.
Absolutely.
Yeah.
Absolutely.
Um, So let's change gears a little bit. I'd like to talk a little bit more about your business, how it came to be, and tell me a little bit more about your story and how you got on your path.
Well, I would love to share. So, when I was 39, like I said, I was diagnosed with breast cancer, and I had a great family physician who just said, 30, Tara, let's get a baseline. I had large breasts and they were pretty dense. And so we did a baseline mammogram, and she wanted me to come back every 2 years to do that. But I waited every three, no family history. I was working, raising children. I didn't feel it was necessary. And at 36, she said, you know what, 2 years, Tara, like stop. I tell you this, you keep waiting three. Well, again, I waited three, and I'm kind of glad I did, because at 39 is when they found and the area, the
Yeah.
cancer. So that a month before, just to back up for a minute, they something in my gut just said, you know what, it's time, you need to just go, because she's going to get on you about not going. And then that's when I went, January of 2012, and they found something suspicious. Went through a lumpectomy, which I didn't want to do, but we went through that, and that's when they found out that it had become invasive. So then I was diagnosed with invasive ductal carcinoma. And immediately I knew, though, I wanted to do a double mastectomy, just because I know who I am, and I know mentally, emotionally, like that I was prepared for it and I could handle that. And I wanted to be aggressive. So with or without reconstruction. But thankfully I was a candidate and I was able to have reconstruction. So we did that May 29th. So I'm about to celebrate my 8-year anniversary.
Wow.
Yeah.
Yeah.
And that's pretty exciting.
All clear.
Um,
Congratulations.
yeah, thank you. And so I did that with expanders. So I had the double mastectomy in May of 2012. Had expanders put in, which are the like saline implants without saline. And then they, over time, every 2 weeks or so, my plastic surgeon, who is amazing, would put saline in it slowly. And we did this over the summertime. And then I knew, when I had a consultation with him initially, he said, we can do nipple reconstruction. And I went, what?
And that was news to you at the time, is that right?
That was totally, I just thought I was going to have breast mounds, but to be able to put a nipple there too, I thought, wow, okay, well, that's amazing. Let's do it.
Yeah.
So I knew from the beginning I wanted to do that. So we actually stretched a little bit further and waited a little bit longer. So I didn't have my exchange to put the permanent implants in until December of 12. And then we healed, waited a few more months. And then March of 13, I did the nipple reconstruction with fat grafting. And at that visit is when my plastic surgeon talked about areola tattooing. And I literally almost fell at the table. Like, I said, you have got to tell me who this is. I have got to meet them. This is amazing. Who does this? I've never heard of it, seen it. Like, I was so excited.
And you're in the medical profession. So was it just very new and emerging technique at the time and it didn't exist? Or was it just very niche?
Well, sadly, it has been around for quite a while. Not sadly on that part, sadly that it just hasn't been talked about, and women don't know, or even men and women. So a lot of plastic surgeons are the ones that were doing it back in the day, because there just wasn't anyone to refer to. And there were a couple of tattoo artists, in the country that were offering this probably the past 10, 15 years or so. And that's wonderful. And I was referred, my doctor and I searched and we did find one, and it was out of state. It just wasn't the right fit for me. I didn't, and I have tattoos, so I'm not saying I'm against that at all by any means, but it just wasn't the right fit for me for this. Like, I felt this was so special, and I just couldn't believe that at that time in 2013, there just wasn't more people doing this. It wasn't being offered more, and it wasn't even talked about. So I ended up having the nurse in the office do it. And she did the best that she could, but she offered me 3 colors, which were chocolate brown, bubblegum pink, and nude, and 3 different sizes. And I just couldn't believe it. Like, wait a minute.
Right.
I don't have a voice in this. you know.
Yeah.
So that was just disheartening. And I moved forward and we went in the office, and it was her music, and it was cold, and it felt like another procedure. And I had been so excited with my girlfriends the weekend before, we were like, what color are you going to choose? And, having wine and having a good time and talking about it. Like, it was exciting because none of us had heard of it.
Right.
And
Maybe that's why it wasn't well known, because it's just the technique wasn't that well developed. It wasn't a great experience. And maybe that's exactly why Pink Ink Tattoo was created.
That's right. Well, when I left that day, because I almost left with a half a nipple, it hurt so bad. And as a nurse, I asked the nurse, like, can you put lidocaine on it? And she said, no, 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 we don't use it. Like, tattoo artists don't use it. We don't use lidocaine. And I thought, you got to be kidding me. Like, that's insane. So I almost got up and walked out, but I stayed, and it was super painful. It was awful. It looked ridiculous. It was just, I was so disappointed. But I tell you, life has a funny way of just kind of leading you, or divine intervention, whatever you want to call it. For me, I struggled with my faith through this. My dad died on my first surgery day. It was awful. And I just really struggled hard. And then when I just surrendered and I just said, I can't handle it anymore on my own, like, my whole life has changed around completely. And I remember that day walking out so disappointed and sad, but I went through this long hallway. It's kind of lit up, like magical looking almost. And as I'm walking through, it was like something just came over me and said, you have to do this. You're going to do this. Do it. And when I walked through, my plastic surgeon was standing there, and he said, what do you think? And I said, that's unacceptable. Like, I'm going to go train with the best, and I'm coming back, because I'm going to.
Those moments in life that kind of pick you up and shake you and force you to look at life differently, through a different lens. And I just love the way you described that moment. It's like we all kind of have that moment. I think many of us have those moments, and sometimes some people choose to accept the door that's open, and some don't. And keep telling us about your story. So you decided to make that change.
I did. I came home and I told my husband, I said, I have to do this. Like, and we went from 2 incomes to a half an income, basically, for over a year, just because he was not going to let me go alone. He was by my side, through everything. And so he was like, well, I mean, this is pretty expensive, and are you sure? And, I just knew somehow, some way it was going to happen, and it did. And I'm so grateful for it. So in April 21st of 2014 is my official start day for Pink Ink Tattoo.
So this is actually an anniversary today.
It is an anniversary. I didn't realize it till just now.
We can help you celebrate.
Thank you.
Anniversary for your business. That's fantastic.
So I went to my plastic surgeon, and I called him and I said, hey, I have something to show you. And he was like, can you get in here? Get in here. And so I showed him, and I'd already tattooed 4 women in New Jersey, and he was so excited. And it was just so beautiful, and it looked so natural that he recognized it, and he knew, that I was so passionate about what I was about to, venture on. He just said, he stood up and he was like, Tara, this is my office. You get in here and you help women. You help them. Perfect. And, here I am 6 years later. I don't know if he can ever get me out of there, but so now women do come and see me from all over the country. I've had them fly in from Canada and from Peru, which is such a blessing. Like, for me, it's almost like I get to live vicariously through them, through their experience too, because they choose everything from the music. We'll mix colors together. Like, everything is about you. It's not about me. So if they want 25 people in the room with them, they can have that. I'm not intimidated by that. It doesn't make me, because I'm not the center of the attention. It's focused on that client because it's her day and it's her moment. So.
And it's so much more special and impactful because it's coming from your own experience. You've gone through the experience yourself, and you saw what was missing. And so you saw there was a vacuum, and you filled that, and you created it. So since you've created your business, and you have people coming from all over the world, and that's just fantastic, right? Is it becoming better known? Are you finding that there are other artists who are also now popping up across the country, or are you still one of the few who are really offering the service the way that you envisioned it and you felt was missing?
Well, over the past couple of years, I definitely have seen an increase of areola tattooing being offered at tattoo shops, at, women or artists that do permanent makeup, so pretty much there's probably 100, people in my own city of Raleigh that offer it now. And it seems like it's just popping up around the country like crazy, which is great. We should have options. We should have, but for me, when anybody asks me like, Tara, do you come to Washington State? I don't yet. But, if the plastic surgeon contacts me and says, we need you here, absolutely, I will come there.
Mhm.
But in the meantime, if you can't travel to me and I can't get to you and you're searching for an artist, research, it's so important, make sure that they recognize compromised tissue or, scars. Are they able to tattoo over or around the scar? That's important. And, radiated skin, that's extremely important as well. And, signs and symptoms of infection, what kind of ink do they use? So there's just so many different things that are really important that some people just go out and get a tattoo, even an areola tattoo, and don't put these factors in it. And then next thing you know, they have an infection and now they've lost the whole breast.
So that's a very important distinction, because this isn't about just going to any tattoo artist. And there is a medical side to this, is what I'm hearing you say.
Absolutely.
And so I'm curious, Tara, is there any kind of special training program that is available for being able to train others like yourself so that it can be more widely available to patients across the country and elsewhere?
Well, I know that, being a nurse, I had that. I've been a nurse for 19 years now. So I have that medical part behind me. So I didn't have to do any of that when I did go to train for the areola tattooing. And I say train, and my own, nurse that did it trained 3 times and it just still didn't, so you can train, but just make sure, like, if you get into it, just know how serious it is for us. Like this, you're putting us back together. It's the final step. So if somebody wants to go out and they're amazing at eyebrows, but they say, oh, I can get paid doing areola tattooing. Is it something that you're really passionate about, or are you just looking to make a dollar off of it? Because you're impacting our life in so many ways, emotionally, physically, intimately, it's so important. So that's another thing. Like for me, I only specialize in areola tattooing and areola 3D nipple and scar camouflage. I don't do any, eyebrows. Can't see myself ever doing anything like that because I'm not passionate about that. It's important. But for me, this is what affected me in my life, and this is what I'm passionate about. So that's something else, like just research the artist and make sure this is something that they're serious about. It's not just about a dollar or,
Do you think it should be built into the plastic surgery societies and in their training programs, opening up to medical professionals like yourselves?
Well, from what I gather from the plastic surgeons I work with, and we've had this discussion, they actually do get trained while they're in medical school for this procedure. Mm-hmm. Most of them, if not all of them, do, from what I'm told. So they don't go in depth. It's not about deep, like they get that training, they get to do it. But it's not so much where it's more about adding pigment. Not so much like adding Montgomery glands or making it look like a natural areola.
It's really more the artistry that's missing.
Right, absolutely. Right. And so they can recreate a nipple surgically or not. And then if they, have someone like myself come in, then I can just enhance what they've surgically created by adding that shades of different, color tone, making that nipple, pop and really giving that 3D, or creating a nipple itself, giving that illusion of protrusion, which obviously it doesn't physically stick out, but adding that. So
Tara, we just had a question come in from a viewer.
Sure.
So, we have a question that says, not everyone is like Tara. And even if you do research, sometimes you can end up in a situation like Tara was in years ago. What do you do if you're in a procedure and it's going wrong? Or what if you're unhappy after? Can it be fixed? I think that's a great question.
That is such a great question. And I mean, I can speak for myself. What I would do, although I say this, I mean, I sat there knowing that the procedure wasn't going the way. I knew the color wasn't going to be what I wanted, but I knew I didn't have any other options. So I continued with it. But nowadays, if you're in that situation and you know that either something looks unsanitary or you're just not connecting. So a consultation is always great, whether it's over phone, Zoom, or in person. Then you can kind of feel and see the work environment and what they work with and all that. But you can get up and leave. I mean, if it looks dirty or they're not doing proper infection control, like washing their hands, changing their gloves, if you're seeing that, I would get up and go. Mm-hmm. And I mean, whether you have a half a nipple or not, because call me. There's somebody else that can help fix that. And if you do, I've done a lot of correction areola tattooing. So of course, there's women who have had it done, and including myself, and then call me and say, can you fix this? And then they'll come to me. And of course, once they're healed and, it's been, a couple of months or so, then I'll just redo everything. Even if I have to remove some of the ink, there's a couple of steps, procedures I can do to remove some of that ink, and then we can redo it.
What percentage of your patients would you say come in because of they're unhappy with the job that was done and you're having to fix it for them?
Probably, it's not a high, not so much anymore. Maybe back in 2015, 16, that was probably a higher percentage, more like 40-30% probably were corrective. Now, not so much, especially in my area, because I just think that women are doing more research and they are finding out about me or someone like me, and then, doing the research and making that decision to go to somebody that is skilled at this. So not a lot of reconstruction. I mean, correction.
Well, it sounds like you have a very unique combination of skills. Having that medical side in the insight together with the artistry, that just sounds like it's such a unique skill set. I'm glad that we have the chance to promote what you do and help everybody see what options are possible in the breast cancer treatment journey. So I really want to thank you again, Tara. That's all the time that we have for today's show. And I would like to invite all of our viewers back again. I'm actually going to be having a special episode this Friday, an additional episode. And it's going to be Friday at our same time, 12:30. We're going to be having a very special guest join. Her name is Linda Tantawi. She is the CEO of Susan Komen, New York City. And she's going to be talking about how breast cancer patients and how they're dealing with being at the epicenter of the COVID-19 crisis and how they're coping there. She's also going to be talking from her unique position about how cancer nonprofits are getting through this very challenging time. So I hope you'll join us. Remember that you can sign up for notifications so you'll never miss an episode. And thank you for joining us, and I'll see you Friday.